Okay.
Okay, you know, we need to keep in mind that there's been a case in the United States because a person came from South Africa here and exposed some people. So it's still very isolated. What we are doing at Clarendon Health is preparing ourselves and our staff to act. Our main goal is to identify and isolate the patient, the person of interest. Okay, so, you know, the likelihood of any of these 3 cases started off very low, but they met the criteria. Okay, so I want everybody to understand that, you know, we are doing the things that we're doing today because it's not really necessary that we do today, that we be proficient at this today, and hopefully we'll never need to be deploy these things to the end that they may go. But our goal today is just like in the military. We're going to set our practices. We're going to practice, practice, practice. So if by chance, whatever the odds are, we come across it, that we correctly identify, we isolate, and then we involve CDC and DHEC. So, as it relates, I just want you to understand that. So now, you walk into our emergency room, okay, Amanda?
Okay. Once you have walked into the emergency room or any of our clinics, the same questions are asked. The registration clerk is going to screen you about your travel history. That includes, have you traveled? Where have you traveled? What type of travel did you have? Was it airline, international? Any type of travel related questions that they go through. If you answer yes to any of those questions based on your travel history, you are immediately, the clerk is alerted to notify the nursing supervisor. The nursing supervisor will then come and further screen that patient. That includes going into more depth as far as the travel history, signs and symptoms. Do you have a fever? CDC sets those guidelines out that are changing every day. It's currently 104 degrees Fahrenheit or higher, along with an additional. Oh, I'm sorry. I've said this. 100. Yeah, it was
101.5, and they just dropped it to 100.
That's right. So 100.4 or greater degrees Fahrenheit, along with an additional symptom of muscle aches, fatigue, abdominal pain, nausea, vomiting, diarrhea, unexplained bleeding, which could be your hemorrhage or your bruising. So if they have a positive travel history, a screen as far as a fever and another symptom, they are, based on CDC guidelines and DHEC, they are a person of interest. So we immediately, based on their guidelines, must isolate them. We isolate them along with any persons that may be with them. At that point, isolation means droplet precautions and contact precautions, and notify DHEC immediately. So when we notify DHEC, we notify our region epi nurses. We notify them. They go through another series of questions, which is more detailed about travel. Where did they travel to? What were they there for? How long were they there? What were their flight patterns? If they went by flight, how did they come home? Where did they work? As far as their career, and what any other things that they find pertinent about their symptoms. When did they start? DHEC will then tell us that yes, this is a person of interest or a person under investigation, that then they will issue that quarantine order. If they issue that, then they will allow us to test, which means they will say, yes, test this patient for Ebola. We will notify CDC, or CDC has been notified to come and actually pick this specimen up. If DHEC says no, this is not a person of interest based on the screening questions that we have done, they are not a person of interest, we can take them out of isolation, and then they are treated as any other patient in the facility. The workup as far as of what their signs and symptoms are. So we're not trying to exclude any other symptoms such as flu, tuberculosis, any type of other infectious process that may be going on. This is just another part of our screening process because of Ebola.
Now, if you think about the signs and symptoms, that's very similar to the flu. So that's why we're going to screen every patient because we can't know, or is this Ebola or is this flu, unless we screen everybody. And quite honestly, you know, some people aren't going to appreciate the fact that their registration process is taking longer. And if we determine they're a person of interest based on the CDC screenings that we do, you know, that's going to extend their stay because we're going to involve DHEC at that point. So I just want the public to understand that, you know, we are following CDC guidelines, and just to be aware of that, be patient with us as we step through the process. 'Cause they may think for sure they don't have a problem. What they don't know is it takes one Ebola virus, one, to infect you. But normally it takes a cluster, more than one. And who's to say they didn't pick it up at Walmart or wherever, or the Columbia Airport or the Charleston Airport when they went to pick it? I mean, you just don't know. There's too many variables. So that's why we're going to step through.
And something important too for the community to understand is the incubation period. You know, that changes, that has changed just since yesterday. They were originally saying that it was going to be, the incubation period is 2 to 21 days. Now they're saying they're thinking it's longer than 21 days, possibly even 31. It's important for people to know that even though they have had travel and they may have come in contact with somebody or may not have, you are not contagious until you are presenting those symptoms. That's why it's important for us to do those screening tools to make sure we understand their travel history in addition to symptoms. So if we have a patient that's come in and does have a positive travel history, and then our registration clerk notifies the nursing supervisor, we've gone through that screening process, but all we have is a positive travel history, of course, that is not going to alert us to put them in isolation and to call DHEC. We would only be calling DHEC for those patients that have a positive travel history, a fever, and another symptom.
So we haven't gotten to DHEC.
Yes, we
have.
have.
Oh, yes.
We've had 3 patients.
That's right, the 3.
We've had 3 patients that have come in that have alerted our staff to in our registration process that yes, they've had a positive travel history. Yes, they have had a symptom of a fever in addition to another symptom, and we needed to actually isolate them at that time, whether it was in a registration area or moved to an isolated room at that time, depending on their point of entry. DHEC was notified, walked through their algorithm, and deemed that patient not an Ebola patient under investigation. So at that point, normal procedures when they would come into our healthcare facility would take place at that time.
What do you know about their algorithm? What is that?
Just what we walked through.
Before you get to that, can I insert something else?
Yeah.
I think it's important for the readers and the citizens of Clarendon County to understand we
Need to know about their travel. Up front, don't wait 2 hours to tell us, oh, by the way. You know, it's going to take, this is going to be a community effort, not just a hospital effort. So that travel pattern is very, very important that we are aware of that up front.
And the algorithm is just a decision tree that tells us, if you ask these questions based on the response, this is what you do.
Certainly, well, I have ours. I'd rather give them ours. I mean, it's basically the same thing, but it has I can certainly give you one.
Yeah, I just wanted to go more in.
Okay.
Sure, and you want to walk you through it
Yeah.
again? I can walk you through it again. We can do, we have different ones. We have one that's actually set up for outpatient clinics as well, but we'll walk through the hospital one since that's the focus. Ebola patient comes in, or a patient comes into the registration area. Any point of contact we've covered, whether it's surgical services, the emergency room, or for outpatient services such as the lab, radiology, infusion, wound care, swing bed generations, they're all asked the same screening questions during registration process, and that's about their travel. Have they been in an Ebola affected area? Have they, their family, or anybody they've been in contact with been in an Ebola affected area? Have they had any travel outside the United States, or any travel at all? What type of travel? So where did they travel? If they answer yes to any of those screening questions, that's when our process will begin. If it's no, then they continue their registration and move them along to their point of care. If it's yes, they'll have a pop-up box actually come up on their computer screen that pops up with the nursing supervisor's number, and the nursing supervisor is called. The supervisor will come down with a screening tool that looks like this. That again, we are having to revise every day based on the changes of this virus. We've actually just put a new revision out today. The nursing supervisor then will screen them with the same questions, a little bit more in detail about their travel history. It'll tell them here to monitor, check for the symptoms, which is going to be your fever, your headaches, your muscle pain, your vomiting, diarrhea, abdominal pain, hemorrhage. Do they have any of those? If they have a positive history, their symptoms, then it tells them exactly what to do. Isolate the patient. Where do they isolate? What time? What point of entry did they come in? They're to notify a healthcare provider in that area. They're to notify infection control, so we can call DHEC. DHEC numbers are actually on this screen itself. Who did we report it to at DHEC? What time did we report it? And then DHEC at that time will actually walk us through an algorithm. We also have a staff person assigned at the door. There's a place for her to list who is assigned to that room. An entrance log is posted at the door of who went in and out that room. And there's also just a guard in general, making sure we keep track of who's going in and out. DHEC, of course, has already been notified during this whole process. They start asking the same questions and then, like we said, in further detail. And then at that point, they'll say, yes, this is a case, or no, this is not. No, we, of course, all have had no's. No, it's not. But should it be, then they would say, okay, yes, go ahead and test. That testing process is not like a normal flu swab or quick blood test that we can run to the lab and get your results back in a matter of hours. This is a blood test that we can draw very easily. We have the supplies to do that. It's the shipping and actually the management of that specimen that CDC will not let you do. They actually have to do that in their facility. Packaging we do have available should we have a patient. It has to be either frozen or put on dry ice. There's actually 4 compartments to where you actually have to decontaminate that specimen before you put it in these shipping containers. Then someone from CDC